Hello, my name is Lee Presser. This is my show. I speak frequently to very interesting people. Some of these conversations are so exciting, so intellectually stimulating, I thought others might like to listen in. This is the reason we started recording Conversation with Lee Presser.
Welcome to Conversation with Lee Presser. Today's program is about the importance of children taking good care of their teeth. Today we're going to learn that a majority of dental health problems are 100% preventable. Children should be trained to understand that a healthy mouth and healthy body go hand in hand. Delta Dental of Missouri believes that it is their social responsibility to positively influence young people and to inspire them to establish healthy dental habits early on. Delta Dental is involved in numerous community outreach initiatives designed to improve the oral health and overall health of children. Our guest today is Angie Rightnowar of Delta Dental. She and I will be discussing dental health and the prevention of dental disease. Angie Rightnowar, welcome to Conversation.
Thank you.
Glad we could have you here on short notice. Thank you very much. Well, the big question here is, what is it that Delta Dental is doing? I read you have tons of programs where you're working with children. So just start telling us, what is it that Delta Dental is doing to help prevent dental disease in children?
Great. All right. Well, I started at Delta Dental about 8 years ago, and during that time we've really ramped up what we've been doing in the community to improve children's oral health and their overall health. The first program that we got involved with about 8 years ago was a program called Give Kids a Smile, and that's actually they're a not-for-profit organization. They're in St. Louis, and it was started by a group of dentists. And all of these dentists were traveling around the world providing oral health care to children who couldn't afford health care or who had never been to the dentist. And about that time, they recognized that there were, right here in our own backyard, there were children who couldn't afford oral health care. So they started this program, Give Kids a Smile, and every year, twice a year, they have a 2-day free clinic that cares for over 600 children at each clinic. It's a massive thing. We got involved very early on with their first clinic. We are a founding sponsor of Give Kids a Smile. We're also a not-for-profit, I should say. I forgot to mention that. And since that time, for the last 8 years, we've cared for over 8,800 kids and provided over $3.4 million in free comprehensive care. I think one of the things that's different about Give Kids a Smile than a lot of the programs that we see out there is that it's comprehensive. I mean, when children come to that clinic, regardless of what problem they have, the only exception would be orthodontia.
I was just going to ask
braces, that would be the only exception.
You don't do that?
We don't do that at the clinic, but we do have orthodontists who volunteer with severe cases to help those kids out after the fact.
And where are these kids at? Where are they coming from? I mean, are we talking kids from West County, or we're talking from kids that live in North City?
All of the above, and also kids on the east side as well. And I'm particularly close to that story because I started with them about 8 years ago, and at that time I was the person who was in charge of patient recruitment. So I spent a lot of time on the phone, about 3 or 4 weeks actually, for the first couple of clinics, talking to schools, to churches, to homeless shelters, to civic organizations, purchased a list of United Way organizations, and just started calling people and saying, you know, we are looking for families, for children and families who can't afford healthcare, oral health care, and we want to bring them to the clinic and provide that service for them. And it was kind of funny.
People kind of like,
that's what I was going to say.
What's the catch here?
The reason why I was on the phone for 3 or 4 weeks is I literally had to call people back 3, 4, and 5 times, because the first time I said that, they're like, okay, what's the catch? What's the gimmick?
What are we getting stuck with? Where's the bill going to be sent?
Right. So
is the church getting stuck with this?
Absolutely, and it sounds too good to be true, but it is true, and that's one of the reasons why we're so proud to be a part of it. And it's more than just a clinic, because when we do the clinic at St. Louis University Center for Advanced Dental Education, and the university was very gracious to offer us this space twice a year, so 4 days during the year. And it's awesome because there are like over 50 chairs there. So we can run 50 chairs at a time and push these kids through. Every child spends anywhere from an hour to 3 hours there, depending upon what they need. And usually we have about 200, maybe a little more, dental professionals who are there. And we have another 200 lay volunteers like myself who are there. So it's been very rewarding, and the need is tremendous. One of the things we talk about.
Well, let me ask you, is this like the first time that some of these children have been to a dentist?
Absolutely. For a long time, one of the other things I was in charge of was the parent survey. So we would give every parent who came or every school teacher who came an opportunity to give us feedback. And not only would they tell us on this survey, many parents would say, my child is 10 years old or my child is 12 years old. They've never been to the dentist. Or many stories would be, I work full time, I can't get out, I have to keep this job, I can't get away from the job, and I can't get my kid to the dentist. Even with Medicare, I mean, one of the things we heard from the dentist who started the organization is that even children on Medicare, oftentimes there's a waiting list of months before they can get in, so they just can't.
Why?
I don't know the answer to that question.
The dentists are just not providing
maybe
Medicare
there aren't.
dental?
I don't know the answer to. I don't know if it's because there aren't enough dentists or because the dentists who are involved only have a limited number of slots for Medicare. I know dentists will tell you that if they took all Medicare patients, they can't make a living out of it. So we knew that was a problem. So we take kids that are on Medicare but can't get to the dentist. We take kids who are uninsured. We take other circumstances. A parent's out of work for a long period of time. They did have dental insurance. They don't have dental insurance. So it's a one-on-one kind of situation where if a parent has a need for that child to get care, they get the care. The other thing that Delta Dental does as a part of that clinic, which we try to make it fun and memorable for the kids, is once the kid has had their care for the day, usually if you're at the dentist's office, you get to pick a little toy out of a canister or something. Well, we actually have a party in the cafeteria across from the clinic. So once they've had their treatment, they come there, they get free face painting, they get free balloons. The St. Louis County Library actually donates brand new books for these kids, so they get a free book. We have entertainers there. Our characters are there, and we'll talk more about that in a minute, but we have a tooth wizard, we have a tooth fairy, we have a bad guy named Plaqueman with a P, and we have a fun big fuzzy bear called Panda. So it's a big party, and that's also the parent waiting area. So the parents are there, and we provide coffee and water and stuff like that.
How do the children respond to dentistry?
Well, obviously some kids don't have such a good time while they're in the chair, and we do see some really severe cases. I mean, this is usually 1 or 2 kids at the clinic who will hear a couple crying, but generally they feel thrilled, and I'll tell you why. When they're there, it's not just about the dental care. It's also about making that kid feel absolutely special. So all this love from 500 volunteers is being, thrown at this kid, and they feel like they're the most important kid in the world while they're there. So, but for the kids who, back to severe cases, some of the kids that we see, the last clinic that I participated in, there was a young man that came out. Luckily, these were baby teeth, but he had to have 9 teeth extracted and baby bottle tooth decay. Kids put their kid to bed with a bottle of juice or a bottle of milk in their mouth, and oftentimes by the time the kid is 5 or 6 years old, they're
rotted out.
Totally rotted out, and the dentists tell me that they have to come out when they're that bad because then the infection can go into their adult teeth as well, up in the gums.
Well, I was going to say though, when you're 6, it's a long time till those adult teeth are coming in.
Yeah. It is, I know. And his sister, unfortunately, had to have 5 teeth pulled. So neither one of those kids were that happy when they were in the dental chair. But when they come over there, amazingly, after they kind of get their bearings a little bit, they're kids. So they quickly forget. what they've been through, and you know, they're just running around having a really good time.